well as recorded via the internet and the recording archive for future viewing. Could all participants please mute themselves when not speaking in order to avoid any background noise or feedback when other participants are speaking. If a participant wishes to speak, can they please put their hands up if they can be seen on screen, or use the raise hand function. Please ensure that all debate is raised verbally and not via the chat function for the sake of the recording. The chat function may be used to highlight any technical issues and/or to grab the attention of the chair or democratic service officer. If any participants has difficulty hearing or being heard when they are addressing the committee, then they should let the chair of democratic or democratic officer know. If they have a webcam, then they should be turning this off, as this will help with broadband or Wi-Fi bandwidth, so they are at least can hear or be heard. If you bear with me while I just swap to the agenda. Here it is. Thank you all once more, and we'll start with agenda item 1, which is the appointment of the vice chair. Do we have any nominations?
I would like to nominate Neil Thomas.
Thank you. Do we have a seconder for Councillor Neil Thomas?
Seconded, Councillor Buckley.
Thank you, Councillor Buckley. Do we have any other nominations? No other nominations. Then I declare Councillor Neil Thomas Vice Chairman of Healthy Living and Scrutiny Committee. So
If I may, Chair, just to double check, there isn't any dissent to the nomination?
no dissents as far as I could see. There wasn't any. Double checking.
Thank you, Chair.
Yeah, congratulations, Neil. I'm glad to have you back. Thank you very much, everybody.
Thanks, Chair.
Moving on to agenda item 2, apologies for absence. Do we have any?
Gareth Ball.
Thank you. Anybody else?
I believe that's a full committee for you now, Chair.
Thank you very much. And agenda item 3 is the minutes of the meeting held on the 7th of March 2023. Can I have approval for this, or would you like me to
move the minutes?
Thank you, and I second that. And before we proceed any further, I would just like to welcome our new members today, which is Ian McMullen and Jason Bennett, and 2 new officers. I would also like to welcome to the committee Ian Buckley and Emma Goodjohn. You're very welcome, and we hope that you have a great input into the committee. And I'd also like to let you know that I have written to Helen Payne and Susan Lloyd-Selby, who've now left the committee, for their dedication and hard work on this particular committee. And before we move on to the declarations, Ian, I wonder if you'd like to introduce yourself as you're new to the council.
Yeah, good evening, everyone. Ian McMillan, I'm the Head of Resource Management and Safeguarding in Social Services. Nice to meet everyone.
Thank you. And Jason, could you introduce yourself to the committee, please?
Good evening, Jason Bennett, Head of Adult Social Care and the Vale Alliance.
Thank you all very much. Moving on then to agenda item 4, which is to receive declarations of interest and the nature of such interests, including whipping declarations under the Council's Code of Conduct. Please, can I point out to everybody that if you have any declarations of interest, please can you contact the monitoring officer or the Democratic Services if you need any help in deciding whether you should be declaring or any help at all with it. 48 hours before, as I said, and they would really appreciate that. So if we don't have any declarations, then can we move on to agenda item 5? And let us welcome Becky Ingram and Katie Simpson, who will be given a presentation of Cardiff and Vale University Health Board on children, young people and family health services. I have no information on this, so if we could move straight into agenda item 5. Thank you, Health Board. Take it away, Becky.
Hi, good evening, everybody. So I'll just introduce myself. I'm Becky Ingram. I'm the newly appointed General Manager for Children and Young People's and Family Health Services in Cardiff and Vale. And if I just ask Katie to introduce herself as well, please.
Good evening, everyone. I'm Katie Simpson. I'm the Deputy General Manager for the Children, Young People and Family Health Services Directorate here in the Health Board.
Thank you. First of all, can I just thank you for the opportunity to come and talk to you? I know Rose, my predecessor, talked to you a couple of years ago around our emotional wellbeing and mental health service. So we've come back today to give you an update of where we've got to, what services we've got, what our offer is, and what our ambitions are moving forward. So if we go on to the first slide, just to remind ourselves where we've come from, and is that previous to CAMS being within Cardiff and Vale, it was previously hosted by Cwmtâth Health Board. Now, has everybody seen the next slide? Ah, here we go. It was previously hosted by Cwmtâth University Health Board. And actually, in my previous life, I used to work in finance many, many years ago. And I used to work in Whitchurch Hospital within the finance team when CAMS was actually part of Cardiff. So it's kind of come full circle to me. So in 2016, the primary mental health part of the service was repatriated to Cardiff, then 3 years later, specialist CAMS. So our newly formed service, so this is our objective, to provide an integrated children and young health service with a single point of access and no wrong door approach. So back in 2020, we began our journey to integrate these services to form an emotional wellbeing and mental health care group, with the aims being we wanted to remove artificial boundaries that hinder access to support. We wanted to provide one clear offer with an integrated, aligned service with a clear identity and branding. As it says, we wanted to have no wrong door principle with one single point of access for children, young people and their families. And we wanted it to be streamlined in such a way that we could find the appropriate support without families and children having to go through multiple assessments. So we wanted to have a clear assessment and therapeutic offer, which was underpinned by a very robust triage criteria. And we wanted to establish links with early help services within our local authority. And then finally, we wanted to provide a seamless service from prevention through to specialist interventions for those with complex needs. And I guess underpinning all that is that we wanted to do this with the engagement and co-production of our users. Thank you. Next slide. So I'm not going to talk to this izzy slide here, but this just shows, it's a schematic of all of the services that we've now got with our emotional wellbeing and mental health service. And then later on in the presentation, Katie will talk to you about some of the new services that we've developed. And I suppose the arrows just show the schematic of how we've got a seamless service around the teams with the single point of access at the top. We can just move on to the next slide, please. So the improvements that we've made since we've developed our emotional wellbeing and mental health service, we've grown our workforce. We've been lucky through some Welsh Government transformation funding and health board monies. We've been able to grow our teams and our capacity exponentially and introduce new clinical offers, which we'll talk about later. Despite the national recruitment challenges, we have been really successful in our recruitment and have become a desirable service to work for. And we have also developed our grown-own structure with new roles across a range of professions. We've developed a single point of access as described in the other slide, and this we've extended this to include clinical professionals that are able to offer timely triage, but also to provide a consultation services for professionals to phone into and discuss potential referrals, which can then ensure that young people can be referred or directed to the most appropriate support for their needs. And as part of that single point of access, if it's not clear at point of referral where that pathway should be, we've developed MDTs, which is a weekly MDT with health board professionals and early help within the local authority to actually discuss on a case by case basis to ensure we're pointing that child and young person into the right pathway. We've developed a sustainable service with much improved waiting times for assessment. I think when we came to talk to you a couple of years ago, we were delivering 80%, but now on average, 90% of our children and young people are being assessed within 28 days with an average wait of 19 days. So we can see that's much improved. We've now got a digital offer, which we were working to prior to the pandemic, but I think the pandemic gave us an opportunity to fast track that. And now we're able to offer a digital offer, but alongside a face-to-face appointment. We've got clear pathways of care, and we've improved our crisis pathway with increased staffing and extended hours. So it's currently available 9 till midnight, Monday to Friday, and till 9:30 on a Saturday and Sunday. And by June, we're hoping to extend those hours till midnight. So it'll be 9 till midnight, 7 days a week. As I said in the previous slide, we've done all of this with the engagement and co-production with our children and young people who've been involved every step of the way in developing our website as well. So that's just a snapshot of some of the changes that we've made, some of the improvements that we've made to try and improve the service for our children and young people. So I'm now going to hand over to Katie, and she's going to describe some of the new services that we've set up. Thank you.
Thanks, Becky. So as well as transforming our existing services, we've been able to implement a number of new services into our clinical offer. So we've launched an intensive home treatment service, and this is a service that offers an alternative to admission where a child or a young person with an acute presentation might be better managed in their home or community environment. And it also acts as a step-down service for those who need ongoing intensive support following an admission. We've also launched a specialist eating disorder service, working with children and young people with severe eating disorder presentations, and the service is able to offer a holistic wraparound provision. We've also launched a school in-reach service, which provides consultation, advice and training to school staff, as well as group and direct work for children and young people, and it acts as a point of early intervention for young people. Similarly, we've recruited dedicated emotional wellbeing and mental health school nurses that provide additional support into schools through an enhanced drop-in and a provision for children and young people to be able to speak to someone regarding their emotional wellbeing and mental health. And they're also providing specialist support to children and young people who aren't currently in mainstream education. And finally, we've embedded mental health practitioners within the early help hubs. So we've got Hannah in the Vale, who's a fully integrated member of the front door team, and she provides specialist mental health input as part of the MDT approach to support and care. And then we've also more recently introduced a social prescribing project, which has been funded through the NHS charity. This is to look at how we can support young people again at an earlier point in time, as well as thinking how they may be able to access that without a more formal referral route. So those are all of our new services. So next we just wanted to pick up on where we go next. So we know that we need to improve our treatment waiting times. We recognise we've still got a fair amount of work to do on this, and that some of our young people are waiting too long to access intervention support. We do have a recovery plan in place for that. We've got a number of additional staff that we've retained in terms of additional capacity, and we expect to see improvements from June onwards in terms of those treatment waits. We know that we need to increase our visibility in communities and make it easier for children and young people to access services and support in their local communities. We'll continue to work with our partners through the Empower programme to continue to embed the No Wrong Door approach. and improved information sharing across the system, which often comes as a barrier to making sure that care is seamless around a young person. We'll continue to work with our third sector partners platform to deliver a new early support hub, which we're going to be calling the Hangout. This is where young people will be able to drop in and access a wide range of early support when they need it. So they won't need a referral, and they'll be totally in charge of their own accessing of support and their own support needs. And finally, we'll continue to explore alternatives to admission. We know that admission to hospital isn't always the right thing for our young people, especially when ward areas are not well designed for adolescents. So we're looking at what we can do to improve that, and we're engaging with Welsh Government on the possibility of what an alternative provision for that might look like. So this slide is just a little bit of an infographic, really, just in terms of the demand, and just to give you really a snapshot of where we've been over the last sort of 3 to 4 years. I'm sure that you're aware there's been lots in the media really about the increase in demand and the increase in referrals. So as you can see, in 2021 we saw significant increases in demand across all areas of our service, which obviously impacted on our ability to deliver services in timescales that we would like, really, for children and young people, and we've been working to improve that ever since. We have seen a bit of a reduction in 2022, and there's possible number of factors at play there, really, including the introduction of the new Schools in Reach team and improved multi-agency triage, as Becky mentioned, which hopefully means that young people are being seen earlier and in the service that best meets their needs. For our core service, we are tracking a little bit higher so far this year, but this is likely to be as a result of an increase in March. We had about a 43% increase in referral demand in March. We're not quite sure what the cause of that was, and everything seems to have returned to normal levels for April and so far in May. But yeah, we'll just keep an eye on that one. And then this was just to show you really where we're at in terms of our performance against the areas of the mental health measure. So our assessment target is that 80% of children and young people are assessed within 28 days of referral. As Becky mentioned, largely for the last sort of 6 months, we've been tracking at about 90% or slightly higher, with an average wait of 19 days. As a result of that 43% increase in March, that's why we've dipped a little bit this month, but we're still above target, and we will aim to be back on track probably again by June in terms of hitting 90% and higher of young people accessing services within that 28-day period. And then just in terms of part 2 of the measure, which is about the percentage of children and young people who are in receipt of a care and treatment plan, as you'll see, we're on target for that, with 91.5% of our children and young people receiving that within the appropriate timescales. So just to sort of finish, really, we just wanted to share a quick slide really on the single point of access. I think last time we were here we shared a little bit of information on how to get support. So this really was just to show that the single point of access number when the consultation for professionals is open, and basically that's the main route in and the most helpful probably for people to get support. And then, as Becky mentioned, we've done quite a lot of work with children and young people about information and resources, and we're really proud that we've co-produced this website with children and young people, which is a really great resource for them in terms of finding support about different issues that they might be experiencing, as well as information for parents and professionals. And that's all of our slides. Are there any questions?
Yeah, thank you both very much. It was full of very useful information for us, and I'm sure we can pass that on to whoever may need your services at some particular time. Does anybody have any questions? Yes, I can see somebody's hand up. Councillor Christine Cave.
Thank you for that. That was very informative. As you say, we haven't had a presentation to this committee for some time now. And it's certainly good to see that Cardiff and Vale have taken up the responsibility of children and young people's mental health rather than outsourcing it to Cwmtaf Health Board. So I know you had your arm twisted up your back a bit to be able to do that, but it's good that you did nonetheless. I just wanted to speak to you. You showed a performance slide which you spoke to, and you said you looked at figures about 28-day assessment, or figures around, you said assessment. And of course, an assessment can be as little as a telephone call. And then you went on to say that you were actually referring to access to services. And I just wondered if you wanted to clarify that for me. So you said two things. First of all, you said assessed. The figures were in terms of assessment. And then you said that it was in terms of access to services. And I do think both of those things are different. And so I wondered if you could clarify for me which was actually the 28-day figure. And if it is just an assessment, which, as I said before, can be as small as a telephone call, how long does it take from that initial assessment, roughly, for a young person to access services?
Thank you for that question. So in terms of the wait for intervention, I think at the beginning of the presentation, Katie described how the wait for an intervention is longer than we would anticipate. Our longest wait at the moment, our longest reported wait is 36 weeks. So the target, I believe, is, we're looking to try and do it within 28 days. But at the minute, we're not hitting that. And that's where our focus of attention now is around reducing the wait that children and young people have to wait for their intervention. And I think, as I said, that's an area we know is where we need to improve, and that's where our next efforts are. And we have, we've appointed to a few vacancies, and so we will be having a plan now of how we can start improving that compliance. So yeah.
That's really good to hear. Thank you for that. I just wondered, Chair, if there's an opportunity, especially as you've had this great increase in March, and you're hoping the figures are going to go down by June, and that you're recruiting people and hoping going forward you're going to really focus on this particular issue of access to services. I just wondered if there is an opportunity, certainly within the next 6 months or year, to come back and speak to us about that.
Yeah, we're more than happy to come back in 3 or 6 months to give you an update. We'd be very welcome to do that and look forward to it. Thank you.
Yeah, you beat me to the punch there, Christine. I mean, this committee used to come here regularly every year until COVID, and I'm sure the committee would very much like you to come back, as Christine has asked, 6 months to 12 months time, to give us regular updates as you used to before. Would that be okay? Okay, lovely, thank you. Can I bring in Councillor Ian Buckley now, please?
Thank you, Chair, and thank you for the presentation, both. My question is in regards to the Hangout. Is that a physical site, or is that just a name of a place or a process that you're currently doing? If it is a physical place, is it a one-off, or are you looking to replicate it across the area?
I'll answer that. It is a physical place. It's only recently been opened, and it is on Churchill Way in Cardiff, and it's being provided by Platform Charity. So yeah, it's not just a virtual name, it's actually a place where young people can go. And the opening hours are, I can't remember the exact time, but it's open at about 9 or 10 at night. So it's sort of later into the evening. So it's for our older young people, if that makes sense. So yeah.
Lovely. Thank you both. Cheers.
Thank
Sorry,
you, Ian.
just to jump in there, just to reassure as well, there will be the platform team are looking at how we could deliver some pop-up sites across different locations in the Vale to make it more accessible for Vale young people as well. And there will be some online provision as well that they can access should online be more preferential for them as well. So
well, with your pop-up sites, use us to help advertise it. Thank you very much. Cheers. Thank you.
Thank you, Ian. Can I bring in Councillor Jane Norman, please?
Thank you, Chair. Thank you for the report. Very interesting. My question is, how do you advertise these facilities to the young people? Is it via schools or websites, or how do you get this through to the young people that these facilities are available to them, and for them to access them, such as the pop-up shops or the hub, etc.?
So through our School in Reach team, they're working with all of the schools, and we've got our website for our children and young people, which will signpost them. So we just need to get out there really. And if you've got any ideas of any other way we could reach out, but we have developed our School in Reach service as well, which is particularly working with the children and young people. Katie, have you got anything else to particularly?
So I think just to reassure that everything has been done for the Hangout in co-production with children and young people. So, you know, we know that children and young people often look for information on the internet or through social media. So we're just kind of building those platforms and presence really at this moment in time. But as Becky said, if there are other ways that you feel might be helpful throughout the Vale for us to share that information, please let us know, and you know, we'll explore all avenues really.
Thank you for that.
Thank you very much. And can I ask Councillor Neil Thomas, please?
Thank you, Chair. Yeah, thanks for the presentation, both of you. I agree with my colleagues that it's interesting, informative, and welcome, as is repatriating the service to Cardiff and the Vale. On the point that Christine Cave raised about the length of time to for some individuals to actually start gaining access to treatment. Becky, you said up to 36 weeks is the longest that we've got. I'm assuming that's extraordinary rather than the norm. I mean, 8 months in any child's life is a considerable lump, and any efforts to bring that down to an acceptable level will be hugely welcome. You talked about the single point of access. I'm assuming that that's a one door, which then filters to other services, filters down into the services and directs the child to where they need to go, so they don't, as you mentioned, they don't have to make multiple referrals to multiple places. But who can access that single door? Is it accessible to social workers? Is it accessible to teachers or schools? Is it accessible to people like myself who may be concerned about a young person in their ward and want them to be taken into consideration? Perhaps would be the way of describing it. And my final question is can you tell us a bit more about the social prescribing service, because I don't understand what that is, please. Thank you very much.
Okay, so the specific question around SPOA and who can refer in, it can be referred from school, GP, other services within health. Have we ever had to refer? I don't know, this is a good question. Have we ever had a referral in from a counsellor? I don't know. I assume we would accept. I'm looking over there because we're sat in the same room. So yeah, and it's exactly as you said, because what we don't want is for a child to see the GP and they send them somewhere, and then they come to us and we say, well, actually it's not us, you need to go here. So they come into one place, and if it comes in and it's like a barn door obvious, yeah, this child definitely needs a mental health assessment, that they will go to that pathway. If it's clear they just need some signposting for some early help, whatever, then that will be it. But as I say, if you've got that child that's in the middle, you want to have that discussion as an MDT to decide jointly what that right pathway is, rather than just us as health saying, no, it's not us. So I think that's why it's really important that it's you know, multi-agency really. And then did you want to talk a bit more about the social prescribing? Is that okay? Thank you.
Yeah, so just to pick up on the social prescribing, really, it's about supporting young people in their local communities to access community-based activities that would be beneficial to their emotional well-being and mental health support. One of what we're really trying to do is engage with communities to make sure that young people have that kind of wider support network and are aware of things that might be happening in their local communities that they can get plugged into, that would aid them in, feeling less socially anxious, or might support them with things around their diet, in terms of maybe attending a cooking class, because actually they know when they're emotional they might eat a bit more and they eat a bit unhealthy. So really, I guess the premise of it is about plugging young people into support into their communities for the benefit of their emotional well-being and mental health. There will also be the opportunity, which we haven't really had that many kind of young people at this moment in time that require that, but there might be a young person that might think, it would be really great if I went horse riding, because actually the connection with an animal might feel really great, and that might be really, really helpful for me. So we would work with them to explore how we can get them aligned and tuned into something like that sort of activity, rather than, I guess it puts them a little bit more in control of their mental health as well, maybe kind of at that earlier stage when they recognise that there's an issue that some support would be helpful for, but they recognise that actually full sort of mental health support from a clinical service isn't quite where they're at, but actually trying to really build that sort of community approach to helping children and young people with the dilemmas that they might be facing. Don't know if I've done it justice at all there, but happy to send more information if that would be helpful.
Thank you very much for that. I mean, I welcome the whole idea of cooperative working and partnerships. I mean, yes, children do encounter very many agencies in their young lives, and the fact that they can work together and as has been said, provide a wraparound service for the young people is hugely welcome. Just as an aside, in terms of children working with animals and stuff, and that can be therapeutic, talk to the Dogs Trust. They like volunteers.
Thank you.
Thank you.
Thank you, Councillor Thomas. Two more quick questions, and then I'm going to move on to our next speaker. So can I bring in Councillor Marianne Colt, please?
Thank you very much. Thank you. And to a certain extent, Councillor Thomas has asked what I wanted to ask, really, but the social prescribing sounds really good, but I'm not sure how it would work. For example, I think there's a good example about the Dogs Trust who like volunteers, but how would volunteers be supported in that environment? Is there going to be something in place for the organisation to kind of keep an eye on them? That's just a point I raise. And about the formal, the social prescribing project, you said they can come through a not formal route, but I'd like an example of what those are. So, for example, we've just asked, can counsellors refer? So just an example, I'm not expecting you to answer it now, but perhaps if we could find out what sort of people you're expecting to hear from. But I do think it's important that when you send people to social projects somewhere, what happens if something goes wrong? That's my question.
So each young person that comes through the social prescribing service is allocated what we call a community connector, and that person will stay with them through their journey of kind of their chosen support and activity. So they'll meet with them on I think it's well, it will depend on the frequency, but largely it might be monthly, might be weekly, depending on kind of where that young person is. It'll start very much with a what matters to us conversation, and then we'll work together with them to find out the best course of support, and obviously we'll stay with them through that period of time, and then obviously when they kind of completed that activity, we'll get to the point of a kind of a where do we go next and what does that look like. But they'll always have someone supporting them through the journey, and we're just working on the additional, so very much to start with, because the pilot only went live a couple of months ago, most of the referrals at this moment in time have largely been through our single point of access, so where we've already kind of got referrals coming through. But but we're extending that to work with early help to look at how we might receive referrals from early help. We'll also be extending that through our school inreach service, and I think we're going to have a look and explore as well how we could make that more accessible. Obviously, we've got quite a good engaged children and young people who've been really part of the development of the project, and so I think we're tied into a lot of the youth groups that exist across both Cardiff and the Vale, and are working with children and young people to access services through those routes as well.
Thank you, Katie.
Oh, thank you
very
much.
You. Good question, Marianne. Councillor Robert Fisher.
Hello there, good evening. Yes, I just wanted to say, from my sort of own personal family experience, I can say that the professionals that provide the services that you're talking about are very dedicated, and they provide an excellent quality of service. But I'm curious as to, is there a clearly defined complaints process available?
That's that. Yeah, there is a complaints concerns process within the health board, and we can share that as a point of contact. I can share that around. But yeah, we have a corporate concerns department, and if a concern comes into complaints comes into the organisation, then that is directed to the to the service that is actually providing it to investigate that complaint. Okay. So yeah, we have got a formal process, and as I say, I'm quite happy to share that. There's like a generic email as well that can go.
I think our next speaker may be able to throw some light on that as well for you, Robert. How to complain. So on that note, thank you very much, Becky. Thank you, Katie. It's been great to have you here. It really has. And we look forward to seeing you again as soon as we can. Thank you both very much.
Chair, before you let them escape, can I just ask if we can have? I put it in the chat, but I'm not sure if they've seen it. Can we have the slides, please?
Of course you can.
Thank you very much.
Yeah, Chair, if you don't mind, just to wrap up the item, I was going to ask for a copy of the slides myself, so thank you, Councillor Thomas. I'd be grateful to have those. But obviously you did have a recommendation put forward from Councillor Cave with regards to receiving the presentation to 6 to 12 months. With the committee's permission, and if you're happy to second, Chair,
yes,
thank you. Are you happy for me to obviously put that on the committee's forward work programme for November this year, which will be 6 months, and I can write out to Becky and Katie at that time for that?
Sounds like a good plan. Thank you, Amy.
And then
is that okay, Becky, Katie? Is that okay?
Yeah, that's perfect. That's absolutely perfect.
Thank you.
Good.
And
thank you for having us.
You're very welcome.
Thank you.
And also your second recommendation then, Chair, would just to be to note the presentation this evening, obviously with thanks to our NHS colleagues.
Yes,
is the committee happy with that?
Note and thanks. Yeah, no dissent. Thank you very much.
Thank you.
Hope to see you soon.
Thank you.
Bye-bye.
Bye.
Which brings me to a very exciting speaker as far as I'm concerned, because I asked if he could be put on the agenda. It's Llais Wales. It's Stephen Allen. He'll introduce himself in a minute. I think that is such an important item that he is going to speak about, to pass on to everyone, for them to know who they are and what they do and what they have achieved. And thank you very much for coming along, Steve. And I pass it straight over to you now.
Thank you, Chair, and thank you for inviting Llais to come and talk to you this evening. Yes, my name is Stephen Allen. I'm the Regional Director for the Cardiff and Vale region of Llais. This is my second incarnation. We were with Community Health Council before that. I'll explain that in a moment or two. So we are a new organisation. We were formally operational from the 1st of April 2023. So I got the slide here, so I'll share my screen if that's okay with you, Chair. If I can work out how to do that. Unfortunately, my computer is very slow today, so it's having a bit of a rest, I think. Bear with me 2 seconds. I can get it to share. Right.
Yeah, that's come on screen for me.
Okay,
Steve.
you've got that, brilliant. Okay, and I have sent over the slides to you anyway, so you've got them somewhere. I think they were sent over earlier on today. So welcome to SLICE, introducing SLICE. So who are we? Well, we're a brand new organisation, a new independent statutory body set up by Welsh Government for the people of Wales to have their voices heard. So SLICE, if you're a Welsh speaker, you know it means voice. That's what the name of the organisation is, across Wales, and we're based on a local, regional and national footprint. So whereupon community health councils previously were 7 independent statutory bodies, we are now one body for the whole of Wales, with regions set up coterminous with the regional partnership boards, and not health boundaries, but on regional partnership board boundaries. So SLICE has replaced the 7 community health councils, and which served for over 49 years across Wales in providing services for advocacy, visiting, etc., as part of their remit. But we're going to build on the good work of community health councils, so none of that will be lost through the process. We've got a new board, which is the board we've been appointed through Welsh Government appointments. Medwyn Hughes is our chair, and Alison Thomas is now our CEO. And the other members then are non-executive members of the board. They come from various parts of Wales. They're not all based in the southeast. They live all over Wales, and they're assigned. Actually, each member is assigned as an ambassador for each area, for each region. So they'll have a very clear view of what's going on within that locality. We have about 100 staff who actually are based around Wales, working 12 offices across Wales. Of course, we've inherited the CHC offices. We will go through a process over the next 18 months, I understand, of working out where offices need to be based and to be accessible. The whole point of SLICE is to be accessible to our communities, both digitally, physically, face-to-face, and also virtually, and also to be out and about within our communities. We are looking for more staff to support our work, and there's a corporate team being established, because again, that was done by the NHS previously. We're no longer part of the NHS in that respect. And again, we've committed a group of volunteers, and I'll expand on that further as I go through this session this evening for you. So I said we're led by our Chief Executive, Alison Thomas, and we've also got a number of key new positions, 2 strategic directors, which have just been appointed. We've got 7 regional directors, which are the old chief officers of the old CHC regions, head of people and wellbeing, and head of finance. But all the teams in each locality office are made up of advocates. They're made up of admin staff who help and support the organisation going forward. Some of you may be aware of what CHCs used to do before with their volunteers. You were appointed by Welsh Government or through local authority or through the third sector. All that is gone under the new organisation. Now anybody can join SLICE as a member of the public. And obviously we're not limited to numbers we were previously. So we were limited previously in this area of 24 members. We now have as many members as we need to undertake the work. And again, the whole point of this is being a volunteer. This flexibility. It's before you had to do 4 or 5 days a month as part of your membership. Now it's basically you can do what you want to do when you can do it. So if it's around your plan, around your lifestyle, rather than having to conform to what we had previously. So we're looking to have a flexible workforce, a volunteer workforce. Diverse, of course, we want to try and reach into communities whereupon we haven't routinely reached into. Accessible and inclusive recruitment process, which is not through the Welsh Government process, which you may be aware is quite a laborious task and actually quite complex for some people to complete forms. And we'll provide learning support to our volunteers to undertake the various bits of work they want to do. For example, we have four areas of work that they can get involved in, and that is community engagement, visiting, virtual visiting, online feedback collector, and representation. So they cover they do cover the 5 sections of the SLICE remit. And again, you can choose to go for 1, 2, or all of those if you so wished. But you provide you training on all of those in order to undertake that role. We got a board, we got a strategic intent, a healthier place where people's voices matter, and we're there to listen, to reflect, and to send that back to both health and social care providers, and for the Health Board and local authorities, both in Cardiff and the Vale of Glamorgan, and also to domiciliary care providers, to nursing residential care homes, etc., in order to amplify the voice of those individuals who are using those services. We want to be a trusted partner with our organisations and the people of Wales. We want to co-produce as much as we can. We don't want to duplicate what's already being done by others. We want to try to work with others to develop those going forward, so we can enhance the person's voice. It's very important that we maintain our independence, as we're very clear to do that across Wales, to make sure people can trust us to come and talk to us about their experiences. And we want to be a service organisation where mutual respect, inclusivity, integrity and compassion drives what we do. So the purpose, we believe, a healthier Wales where people can get their voices heard. We have a vision and we've got a mission which you can read. And the three core areas of key activity really is our staff and volunteers work with people, community representatives and groups in all parts of Wales to hear people's views and experience of health and social care services. We do that and to help us understand what works well and how services can be improved. I think getting the people's voices, the people who are using those services, they are the ones who are using these services day in, day out. They're the ones we want to hear from and to reflect that back to the organisations who are providing those services. We want to share what people tell us with yourselves, both as local authorities and also the NHS. And also to other decision makers to make sure people's views and experience are actually heard. And also when things go wrong, to help and support people to raise complaints. And I heard in the last speaker, you talk about complaints process. That is the putting things right process within health, which we've obviously got a lot of experience in that. Llais is now doing health and social care complaints, so we can now help individuals who wish to raise a social care complaint to help them through the process of doing so. And in fact, we're having quite a complex constructive discussion with your colleagues in your complaints team to meet with them to build those relationships between my advocacy service and them, so they know that we can work together. And actually had really good discussions with Sarah McGill, I think it is, to take that forward, who's one of your officers, I understand. And also Lance as well as another person we've actually had good contact with, Lance Carver. We want to actively promote our work, and to do that, we've actually got a PR campaign going on at the moment. You may see posters with our branding on it, back buses, radio adverts are being used at the moment, and there's about to be a leaflet drop in every house across Wales with a little leaflet to explain who Llais are and how people can get involved and join us, or just to feed in their views. One thing I really do need to mention is NHS bodies and local authorities under the new guidance which has been issued, which I'm not too sure whether you've seen. There's new guidance been issued from Welsh Government on representation in particular, which has come out now as the final version, which places the duty on social care partners and on the NHS to promote our activities, to promote what the work at Llais is doing, and we will be sharing with you shortly. It's just being finalised at the moment, our plan for this year. NHS bodies and local authorities must make arrangements to cooperate with an exercise of our functions, including sharing information with us as and when needed, and also to help us hear from people while they're receiving health and social care services. NHS bodies and local authorities are under a duty to consider and respond to the things we say to them, including about service change proposals. That includes social care changes as well, not just health, although the guidance which has just been issued by Welsh Government is only pertinent to health services for the process there. I think the key thing here is we are there to complement, we're not there to be in place of. So I know you have your own routes and mechanisms in place to hear from people. We just want to add to that, and we want to do that through a good working relationship. We are still waiting for the code of practice to come out on access to premises, which will allow us to hear from people directly where care is being delivered. That's due to be released by Welsh Government shortly. And also the statutory guidance, as I said, which is out. And again, that will be helpful for me to share with you when they come out. Those guidance documents may be helpful for you to understand what that is, and we're more happy to come back and explain those in a bit more detail. But they are hot off the press, so to speak. So basically, Bear with me 2 seconds. So what would we done? So what have we done so far? Bear with me. I think I've gone back one there. Do apologise. My computer's playing me up today. So basically, we want to act with independence, on top of Bill of Wales, collaborating and partnering people. Accessibility and inclusion is really key. We are quite a diverse mixture of individuals who live within our communities. We want to try and tap into each one of those community groups and actually hear directly what they're saying. Influence and advocacy for person-centred healthcare services and good governance, so we use resources to the greatest impact. So again, just because we're Cardiff Vale region doesn't mean other people from other parts of Wales can come and help us to do that work. So it's much more of a flow and ebb process. So we have developed a 100-day plan, which is available on our website. The plan outlines our plans, which the first 100 days will be operational, to launch a national public consultation on our proposed vision, mission and strategic priorities. And we're actively seeking the views for individuals at the moment and diverse voices and communities across Wales. And secondly, we will work with people in our communities to create a simple and accessible ways for the people of Wales to connect with us and receive our services. There's 7 regions which are linked with the regional partnership boards, and they're Cardiff Vale, Cwmtach, Morgannwg, Gwent, Neath Port Talbot, Swansea, North Wales, Powys, and of course West Wales. What have we done so far? Well, we've published regional statements on priorities and activities in health and social care identified by the former community health councils. Ours is on the process being uploaded at the moment to the website. We are actually working with people at the moment to develop some of the services. That we've only been in existence for 5 weeks, so things are still very much in some areas in the embryonic stage of going forward. But we do want to publish our diversity, equality and inclusion policy as soon as we can, so people know across Wales that we're there for them. And to also work with Welsh Government on further developing digital ways of working that support our activities. We're launching a national volunteering campaign shortly to attract and diverse community groups and launching a marketing campaign, which I've already mentioned. We've also got we're obviously sending evidence to the COVID-19 UK inquiry, which we've collected previously under the CHC banner. And also we're also doing how we work together with local authorities, Welsh local authorities yourselves, and NHS bodies are the key partners, but by having memorandum of understanding going forward of how we're going to work together to support each other within the work that we're doing. We have got new roles that we're appointing to, and again, those will be advertised via various routes for the NHS jobs and others services shortly, and also develop partnership arrangements with other UK bodies. So we want to link with Health Watch in England, with the Scottish Health Council, with the Northern Ireland Patient Planning Council, to see how they're doing that, to make sure people's voices are being heard across the whole of the UK as well. I'm coming close to my time. So basically, how we want to work with you. Well, first we want you to obviously to raise awareness of our organisation. We are new. We know it. That's something that is really hard to get back out. I was with CHCs for a number of years and best kept secret in Wales. So they've been on for 49 years. So we really need to hit the ground running with lice. Work with us to develop ways of working and how we can work effectively in partnership. We don't want to duplicate. We want to enhance. We don't want to duplicate what's already happening, and help us to understand the key priorities and challenges for health and social care services in the areas that you serve, because you're the experts, not us. So how can we make sure that those are our priorities as well? And with that, Chair, I'll take any questions you may have. I think I've done that within my 10-15 minutes. I do apologise if I'd overrun.
You shouldn't.
Sorry, I did ramble through it a bit. I have shared you the presentation though.
You shouldn't have worried about that, Steve. Can you tell us, I'll ask the first question if I may.
Okay.
Can you tell us from the beginning, when you receive a complaint, what happens then, and up until the very end?
It's a difficult one to answer, that one, because some of them change. Because under the Putting Things Right project, you've got pre-local resolution, local resolution, and then ombudsman basically. So you've got different stages.
Hospital?
So hospitals.
A complaint from a hospital, from
so
a visitor in a hospital.
Okay, so basically somebody contacts us, they fill an application, they fill a consent for an authorization form in for us. We can then allocate them to an advocate. They will then meet with an advocate to explain what their issue is, and the advocate would then take that down. We would then produce a letter to go to the health service, and that letter would be signed off by the client. So it's not our complaint, it's the client's complaint. They have every say across the way, how it's all is. You know, they can alter the letter if they want to, put additional words in, take words out. It's their complaint. So we just help them through that process. We then submit the letter on behalf of the client to the health service. We instruct the health service to write back to the client with their response, but copy us in so we know what's going on, so we can get the client advised. Sometimes the health service will offer a meeting, and again, the advocate will go with the individual to that meeting. Our role isn't to investigate the complaint. Our role is to support the individual through the complaints process and making sure, and that doesn't mean we don't ask questions. We can ask questions with the permission of the client who we're supporting. So we will go to a meeting with them and help them through that meeting, which is quite a tenuous meeting, especially if you had a bereavement and you're in a room full of consultants or clinicians. It's very difficult to think that you can be heard as a lay person. So we help them through that process. If they're happy with the outcome of that complaint, then obviously we'll close the case and we'll send them a satisfaction form to say what our service has done for them, that they're happy with that. If they're not, if they're still unhappy, we can go back and ask for a further meeting, or a second letter will go in. If they're still unhappy, then we'll obviously do a submission to the Ombudsman's office. And we'll submit the whole of their complaint to the Ombudsman with their permission to do so. And again, each stage, the client actually signs each stage off. So nothing will go over to the health service unless it's being signed off by the client. So that is very much in a nutshell what the complaints process is. We are aware that in social care, the complaints process is different. So that's why we're building those relationships with both the Cardiff team and your team to see what those differences are, those nuances are, so how we can help and support in the most appropriate way going forward.
Thank you, Steve. There are a few questions. Can I bring in Councillor Marion Cope, please?
Thank you. Thank you very much for that presentation. It was really interesting and a lot to take in. So forgive me if I've got this wrong. So if you have a complaint, at the moment, it was a health authority, you go to the concerns team. Are you saying they would actually come to you, not go to the concerns team at Cardiff in the Vale? Yes. Yeah. Okay. Yeah. And likewise in the community, instead of going to the community, you are now the new organisation. Right, got it. Thank you. Thank you very much. Thank you, Chair.
Do we have any other questions? Yes, Councillor Neil Thomas.
Thank you, Chair. I mean, you mentioned the various organisations that you were linked to and go into. How much contact do you have with Care Inspectorate Wales? One of the reasons I'm asking is we've got a report from them coming next to this committee, and I'm wondering what your involvement with them is, please.
Yeah, that's fine. Thank you, Neil. I think what the issue is, when obviously health was our remit prior to April the 1st, so we did engage with CIW, but we didn't actually have a big piece of work to do with them. However, that will change now because obviously social care comes under the remit of Slice. So we are building those relationships with CIW. So again, the CIW reports will come to us. Currently, for example, if I use the health service to a similar process, we've already, as I said, the senior team have had a conversation with CIW about building those relationships. We work with HIW quite closely. For example, we link in with the relationship manager for Cardiff and Vale. I have regular contact with them. We actually send in our reports to them. We send in anything that comes our way, whereupon as upon their intelligence, so it may just generate a visit. And a perfect example of that was the emergency department visit that was held back just after the pandemic. It was based on the CHC report. We went in to see something that we were concerned about, and that led to 3 inspections by HIW going into the emergency department and it making the national press. So, and we intend to work with CIW the same way too, because obviously they are the inspectors, they are the regulators. So we want to work very closely with CIW going forward on any concerns that were coming through our either complaints process or through our own visiting and talking to people and listening to what people are saying about health and social care services. I hope that answers your question.
Does anybody else have a question from Steve? Anybody? can't see anybody, but as you know, Steve, I'm a huge fan,
Yes.
and I know what you have achieved for many with the work that you've done when it was previous to life. So I'm sure if we had more time and you could explain more to people exactly what you have achieved over the years. Oh, we've got another question. Ian Buckley.
Sorry, Chair, and it's not a question. It's just I wanted to wish you all the best, Steve, in this new venture. And no, I just hope everything works out like you said it there, and good luck with everything, mate.
Thank you.
Thank you.
One thing I would say, Chair, and that is, yeah, it is a new organisation, but however, CHC has done a fair bit of work behind the scenes you just mentioned, Chair, and I think we're building on that. So there's no major change in the way we operate. It's still, if it's not CHC, obviously it's under Llais, but the same role, the same work we do is that nothing has changed in that respect, and that's been very clearly the view of Welsh Government. They didn't want that a different system. They wanted us to enhance what had already been done by CHCs previously. And already we're already making an impact at the moment with health and social care across Cardiff and Vale. We've only been in post for 5 weeks as a new organisation, and we've already helped a number of people out with their concerns on social care, being able to direct them to get the most adequate support that they need to undertake their complaint. And we've actually had some feedback to say thank you for that. We didn't know where to come before, so that's really helpful. So I think just being people know they can come to us and talk to us, we'll hear what they have to say, and we can try and help them if we can.
You're very modest, Steve, because as I say, I know exactly what you've achieved and what you actually do, and you've managed to change a lot of policies within the Welsh Assembly as well. So thank you for your time. Thank you for your reports. All the best in the future. I know with you at the head, it's going to be great. So,
thank you very much.
Thank you, Steve, and I'll see you soon.
Thank you, Chair. Thank you, Mr. Dean, and thank you everybody for this evening. Thank you much. Bye-bye.
Thank you.
So just to confirm, Chair, you're happy to, is the committee happy to move with note for the informative presentation tonight? Obviously, with thanks passed to Steve.
I'm sure. Yes, no dissent. So that.
Thank you, Councillor Thomas.
That's supported. Thank you.
Thank you. Bye-bye. Bye-bye, everybody. Bye-bye.
Thank you, Steve. Bye-bye. Right, moving on to agenda item 7, which is the report of the Director of Social Services. It's the performance evaluation inspection of the Vale of Glamorgan Social Services, which Councillor Neil Thomas mentioned just now. Lance is going to give the report. I've read it. I thought it was a positive report, nothing surprising. Things are identified as important and areas for improvement, and I could see very little slippage. So thank you, Lance, and over to you.
Okay, thank you very much. Sorry, it just disappeared off my screen as I started to talk then. Yes, so the performance inspection is a very important inspection for us. It takes place across the whole of the directorate. So typically CIW will also come in and inspect some of our registered services such as care homes. This is a much broader process where they look at adult services and children's services. You'll know that we're divided into 3 divisions rather than those 2, with resource management and safeguarding division supporting both of those areas. And I suppose where you will see them divided in the report between adults and children, they will almost certainly include elements that RMS also provide. The inspection takes place using 4 principles, really. Those are the things that CIW are interested in. They're highlighted in my short accompanying report, which is people, voice and control, prevention, well-being, and that is well-being of our service users, not the well-being of our staff, and partnership. So that's how we're working with health boards and so on to make sure that we're providing the best possible services. And I think the other thing to say is that the report or the inspection came at a time that was very difficult for us in terms of the volumes the volume of demand that we're experiencing, some staffing difficulties that we had, and so I think to have such a positive report in that context it is very, very pleasing. you'll see it within their report, they divided for adults and children's within those 4 principles. They subdivided it again into strengths and areas for improvement. And I think, you know, it's very clear that those strengths reflect very positively upon the work of staff across social services and their managers, but also the support that we get corporately. So that's also very much an important part of what we do. Obviously, the areas of improvement are something that we have to focus on. They're very important. We need to look at them and decide exactly what it is we will do in terms of actions to respond to those. And that process is underway almost as we speak, really. We have a reshaping board in place that is where we monitor all our service plan actions and anything that comes up through any of our engagements with Care Inspectorate Wales to make sure that we are responding to those areas as positively as we can. It's a great way of keeping an eye on them and making sure that they're escalated as needed. That reshaping board includes cabinet member and other directors from across the council. So rather than talk any further in terms of the detail of the report, other than to say that it is a very positive, there are, as I said, those areas for improvement. I would be happy to take any questions about the detail contained within it.
Thank you, Lance. Councillor Neil Thomas.
Yeah, thank you, Chair. First of all, I'd like to explain my reasons for wanting this to come to this committee. As you rightly said, Chair, it's a largely positive report. In fact, it's a very positive report, especially given the circumstances as Lance has described. And I was aware that there were some reports across social media and elsewhere that painted it in a far more negative light than either you or I have read it as. And I actually wanted to set the record straight. It's pleasing. No organisation is going to be perfect ever, and there's always room for improvement, and so there should be. And the fact that Lance has just described has said that we are moving along those lines to improve the service is yet another feather in their cap. And I really didn't like some of the reporting that I've seen, which seemed to be critical of the department unfairly. The reporting, not the report itself. The cherry picking of minor points and blowing them out of all proportion to the report itself. And so that's the reason I wanted it to come to this committee, was to set the record straight and point out that this is in fact a very, very good report from all points of view. Thank you.
Thomas. Councillor Marianne Pope.
Thank you, Chair. Thank you for bringing this so promptly to scrutiny. There are 23 recommendations, obviously, as you all know, and it's impossible to ask about the plans and progress for all of them in this meeting. I think it would have definitely assisted members if we had a table to show the areas for improvement and the plans for delivering on them going forward. So I don't know if that's something that we could consider in the future. Now, I can't find it. I have got a couple of questions. I can't find it, but I'm sure I've read it, that that the Vale have been recruiting from abroad. Obviously, that I don't have any problem with that. I'm just concerned that sometimes the culture and the safeguarding legislation is very different, and I'm wondering first of all, is it correct we are recruiting from abroad? Secondly, what special training is in place if we are?
Okay, if I deal with your first point really, which was about, I suppose, the actions that we're preparing in response to those areas for improvement. We have an incredibly detailed action plan that we've been running for the last, I think, probably best part of 2 years, and it's currently being renewed because we reached the end of the year, and we wanted to I suppose take forward any actions that we hadn't quite fully completed, and I suppose make sure that we update all our other actions to continue our improvement journey. What we do is we feed in all of these areas for improvement into that plan, and that's the work that's taking place at the moment. So this is fresh, so I haven't got every single one of those areas of improvement. Does not have at the moment a clear set of actions associated with them. Some of them will, some of them don't as yet, but they will do, and they will all go in that plan. I'd be happy to come back to Scrutiny Committee if they wanted further reports in this area in terms of our progress against those areas of improvement. That would certainly make sense for me in terms of something that the Scrutiny Committee would want to see. In terms of the other request in terms of recruiting from abroad, we have indirectly using an agency recruited 3 social workers from overseas in children's services. That was a carefully considered approach. We have, again, I suppose, as part of that action plan that I was just describing, have a work stream that is around building capacity in particular areas, and that was one of the ones that we wanted to focus on. And we recognise that along with other local authorities, in fact almost every local authority, if not every local authority across Wales, are experiencing difficulties recruiting and retaining sufficiently qualified social workers, particularly in children's services. And so we developed a plan which included a number of things, growing your own social workers probably being a primary one of those, and probably the largest component of that plan for us. But overseas social workers did include that, were included in that, and we used an agency to deliver that. I think, Rachel, if you're all right, I'll bring you in terms of some of those induction arrangements, because they were, again, pretty intense, weren't they? So perhaps you could talk through what those have actually looked like.
Thanks, Lance. And just to emphasise what Lance is saying, it was one of a range of work streams in relation to responding to challenges in relation to recruitment and retention. So international recruitment with an agency who is established in that field, thinking very carefully about the country that we would identify workers from. The country that we chose was South Africa. That is a deliberate decision based on the legislative framework and the practice framework being the most similar to the UK. There's lots of checks and references, as you would expect. We interviewed very robustly, and we knew when we brought colleagues to this country that may well be the first time that they'd left their country of origin, and for our individuals it certainly was. So there's 2 things that take place, aren't there? One is about how do you receive individuals who are relocating, yes, from another part of the world. What support mechanisms are they going to need? And then also, how do we embed them into the practice here in Wales? So all of that work was very carefully considered in advance of them coming. I'd say to you, Councillor, we've learned a lot, yes, about how we, the things that they needed. So they're the 3 individuals, yes, which means they have 3 individual set of needs. But we also learned a lot about what they needed collectively. So we've spent some time working with them on the practice here, our building on strengths approach, the legal framework, carefully allocating work to them, so not immediately giving them work that was perhaps before the court or child protection, but like you would with any worker actually, is building up that expertise over a period of time, responding very flexibly to, okay, they need a little bit more on this and a little bit less on that, and making sure that we were working across our own division and directorate, but also with partners to make sure that induction was embedded. I would say it's been really interesting for us. I think 3 is, for an authority the size of the Vale, 3 feels about right. We don't have any plans at this stage to recruit more social workers internationally. We have also seen in the interim period an upturn in our recruitment. So our needs perhaps aren't what they were at the time. But also I think you've got to think about any team needs a mixture, doesn't it? So it needs a mixture of people with a greater level of experience and those who are newer. So you can't have all teams with newly qualified or newly arriving from other parts of the world. You need a mixture in teams. So I think it's been a positive initiative for us. Other authorities in Wales have asked to talk to us about our experience. They too are looking at things like that. I think it's important not to underestimate what this move is for those individuals, and important to make sure that your professional as well as your personal induction arrangements are embedded. And we've worked very carefully to make sure that we've done that. Yeah, so wrapped our arms around them, if you like, Councillor, in from a professional practice perspective, but also a personal well-being perspective.
Thank you. May I come back, Chair?
Yes, please.
So first of all, thank you both very much. Yes, I think it would be really helpful to have further reports and for this committee to look at the plan going forward. So I won't ask you any more questions on the individual points in the plan. And thank you, Rachel, for outlining what you've said. And I understand from what you've said that you had a careful recruitment programme. I don't have any problem with recruiting any members of staff from anywhere. Understand that recruitment and retention is an issue, and if you work in the NHS, you'll know that they're very used to having people from a variety of places. I think what you've outlined is that there was a robust induction and supervision programme, which is appropriate, obviously, and also particularly I think you answered my question about legislation, because things happen differently in different countries. So thank you for that, and I feel reassured. If I would like to pick up, though, on the Facebook post, members will remember my question to Council concerning the Facebook post about this report. As a councillor, I remain very unhappy with the communication on this matter. I think with 23 recommendations, some of them quite crucial, in my opinion, this report should not have been described as glowing. The report generated very many negative comments for the frontline staff at the Vale, and no answer to any of these comments was provided on the social media platform. My question is really, are there any lessons to be learned from this?
I think, sorry, Chair, I wait to come in.
That's okay, go on.
I think, Councillor, it's always right that we review what happens when we put any information out in the wild, as it were. I think within that, I was advised by our communication colleagues that while there were, I think, 100 or so negative comments, there were more than that in terms of positive reactions to the post. That's where people click and a thumbs up or a smiley emoji, whatever it is. But there were also 10,000 people who saw it. So and I think getting positive messages out is really important to me. I think having discussed it further with comms following your question, I don't want to repeat what Councillor Williams responded to you at Council, but I think that we do need to be careful about which social media platforms we use. I think getting the message out amongst the professional colleagues is really important, because colleagues, social workers in other authorities will see that the Vale has had a really, really positive report, and as such will want to come and work here in those posts that we've just been describing are really difficult to fill. So there's a balance somewhere, and I think we look carefully at the kind of responses we get. Facebook is quite notorious, and we may have to choose more carefully in the future.
Thank you.
Thank you. Thank you, Lance. Can I bring in Councillor Christine Cave, please?
Thank you, Chair. Yes, just on the last point that was raised, I think the most important thing is to be seen to be transparent, and that is certainly what the department did. If you publish something as widely as you obviously did, I think that can only be a good thing, and it certainly you know, whenever you post something, it's going to attract a variety of different views. And no doubt you will be able to look at those different views and add that to the some of the things that were raised in the report. So it can only, I think it can only be of benefit to the department to be able to be seen to be open and transparent in the way that you have been seen to be doing. So that can only be a good thing. My question is quite small actually. It's just the fact that this report was actually undertaken in March and November 2021. Obviously that's you know, 2 years ago now. No, am I wrong?
Yeah, sorry. I think the reference to the March 21 was their assurance check, was their previous kind of mini inspection, for want of a better word. So this took place in January 23.
Oh, brilliant. That's my question, was when are they going to do it again? So they've already done it. So that's really quick work, isn't it? So yeah, well done.
Fortunately, they've said they don't feel the need to come back in a hurry, so that's positive for us as well.
Well, you've got some time to look at certainly the points that they raised, didn't you? Yeah, thank you.
Yeah, I think we knew that there were areas of improvement. Councillor Julie Lynch-Wilson.
I just like I work in a private care home, and from the recruitment perspective, recruiting overseas is just something that private care homes do quite a lot. And the safer recruitment criteria we have now, because the world has become much smaller. You can check far more easily than you ever could. And we have Romanian nurses, and we've just recruited a South African nurse, and it's just the way that the world is. And so there never seems to be a problem with our overseas staff. It's extremely difficult to recruit. Recruitment actually is getting a little bit better. It has been very, very difficult, but yeah, I just want to reassure the councillors that there's quite a lot of things in place before you take on staff from wherever they are, this country or other countries.
Thank you, Julie. Thank you very much. Ian Buckley.
Thank you, Chair. And I wanted to say the questions I had on the report 2.9 about the meaningful reflection, 2.14 contacting the social workers, and 3.9 about answering the phone calls. I think you've answered that for me in saying you're recruiting the extra staff to help them. What I wanted to say is, even though those were points for improvement on the report, please thank your staff. The only reason that those things had to be improved on is because they're working so hard with the recipients of the care that they're giving them. So I'd like you to pass that on to your staff as well. Thank you.
Thank you very much. I'm sure that's greatly appreciated. Does anybody have any questions? Any questions? No. Well, as I said, Lance, I thought it was quite a positive report. The recommendations are that we note A and B. Is everybody happy to note A and B? Do you have any dissent?
Sorry, Chair. I think you're referring to the recommendations for the next item. So the recommendation for this report is to note the performance evaluation and inspection report as appended from CIW. But I was also going to query, because obviously there's been mentioned during debate about having a further report brought to the committee in the future on the recommendations from the CIW report.
I think it would be good to have a further report if everybody agrees to it. Does everybody?
Can I suggest in 12 months' time, when all the improvements have had a chance to be sort of embed themselves and see what the situation is then?
Yeah, I think we need it later rather than sooner to give the department an opportunity and a chance. So, Amy, can we leave it to you to discuss that?
Marianne's got her hand up as well.
Yeah, thank you, Chair. I'm not expecting to have the plan all finished, but I think the number of recommendations and a couple of concerning ones, it would be just nice to have. Lance has said that he's got a table, it's not quite finished, but when it is finished or when it's appropriate, would it be possible for Scrutiny to see it? I mean, I don't think we have to put a time on it. We don't have to wait a year. Some of these things need action sooner rather than later.
Rachel?
So I was just going to say, Chair, and obviously in that circumstance, there are particular recommendations that Councillor Cowp is referring to. So I think it may be worthwhile having a conversation with her after the meeting as which one she's referring to. Yes. I don't know how Lance feels about that in terms of coming. We can certainly keep the recommendation to have a further update in 12 months' time, if the committee are minded to. But obviously, if there are ones that Councillor Cowp is interested in having that information sooner than that, I'm sure we could discuss with Lance what those are, but in particular, and then how we can get that information to the committee at a later date. Would that be agreeable, Councillor Cowp?
Yeah, I'm happy to have the conversation. It doesn't need to be after this meeting because obviously we can just arrange that whenever is suitable for you. That would be helpful for me.
Okay, is that all right for yourself, Lance?
I'm happy to whatever committee would like. I mean, from my perspective, I'm expecting that the plan should be done in the next month or so. So we will have the table. I think if I share that with committee, we won't have much more of a discussion than we've had today, because it will be a bit of a retreading. I'm happy to share it with people, but perhaps I could do that out. I mean, it doesn't have to be part of the committee meeting, does it? And then it'd be good to be able to come back in 12 months' time, being able to highlight what I would hope be a lot of progress against those actions.
Are you happy with that, Councillor Cope?
I don't know what the final decision was there, Chair. Sorry. I'm happy to talk to the officers anytime. I'm suggesting not after this meeting. If Lance has said this will be ready in a month and he's going to share it with the committee, I'm happy with that. I think that's fine, because then if I've got any queries, I can come back to yourself or to Lance directly. Yeah. I'm happy with that. And yes, come back in a year then.
Yeah, the information that Lance is putting together in a couple of months' time, if he brings it to committee, it won't be an awful lot different than it is now. Is that right, Lance? Is that what you said?
Yes, but I could email it to committee members so that you have it and you can see it. And then if you have any questions, I'd be happy to deal with those. And then that wouldn't take up committee business time. And then what we could do is I could come back in 12 months' time with a report against our progress against those actions. I
think that's a good idea. Are you happy with that, Councillor?
Yes, I am. Thank you, Chair, because there's so many things I was interested in. I couldn't possibly have asked about them all. It wouldn't have been fair to you all. Thank you.
So just to clarify, Chair, obviously for the sake of the minutes, the recommendation, you'll have two recommendations for this report tonight. One, that the report has received this evening is noted, and second, that a further update be received in 12 months' time. Then the matter of sharing the updated action plan, as Lance has referred to, will be dealt with separately after the meeting, and dealt with obviously under the action sheet for this committee to all committee members.
Yep. Is the committee all happy with that?
Yeah, Councillor Williams has got his hand up as well.
Yeah, I can see that. Thank you. I was just trying to deal with I was just trying to deal with what Amy was saying first.
Are you happy to second, Councillor Thomas?
Absolutely, yes.
Thank you.
Thank you. So I don't think we have any dissent, so you can take that as read.
I think you have. I think you have a hand raised from Councillor Williams.
I can see it. I'm getting to it. Don't panic, Mr. Mannering. Councillor Eddie Williams.
Thank you, Chair, and thank you. I just wanted to reassure members of the panel that the board, Lance has mentioned the board that will deal with this, and any exceptions and issues that arise, then they will be brought forward. So there's not a case of I agree that there is a concern to wait till next year, but there's recognising we've got to take time to implement the plan, and that's, but it's just that reassurance that there is a board that's responsible for making sure that happens. That was all my comment was.
Much. Right, so I think we've dealt with that agenda. Teach me to not number my notes. And which takes us on to the report of the Director of Corporate Resources, agenda item 8, the fourth quarter scrutiny recommendations, tracking and updated work, programme schedule 2023 to 2024. Amy or Lance?
I'm happy to take this one, Lance. So as you're aware, committee, this is a standing rolling report that is property of yourselves. I maintain that for you as the administrator. You've got 4 appendices with the report this evening. So appendices A and B refer to previous recommendations that you've kindly made as a committee. And you'll see from those that all of those are marked as completed. So there's no points for me to highlight with yourselves this evening for those. Appendix C is the annual Cabinet Forward Work Programme as previously agreed by the Cabinet, and obviously your Forward Work Programme as the Healthy Living and Social Care Committee takes account to that. And therefore Appendix D is your annual Forward Work Programme for the year ahead. So this has been maintained through the year by myself in liaison with the chair and vice as per on screen this evening. And obviously the officers have I've liaised with them, with the officers in terms of what's coming and what's expected. I'm pleased to report that as a committee, you don't have any items that were in the previous year that you haven't received and therefore has slipped to this year. So you don't have any slippage as a committee. You did receive everything as expected last year, and all of your recommendations obviously have been completed as well. So like I said, it's a rolling report. You're having it now for annual, and then you will have it again quarterly for quarter 1, 2 and 3. So the report is kindly asking you this evening through the 2 recommendations for 1, to approve the status of the actions listed in your tracking appendices A and B, and then secondly for your permission to publish the annual Forward Work Programme at Appendix D on the public's website. Thank you, Chair.
Thank you, Amy. And thank you, Amy, for keeping an eye on this rolling report for us as well. So the recommendations are that we note A and B. Is everybody happy with that recommendation? Thank you, Neil. I see no dissent, so I can take that as an okay sign. And do we have to, can we approve to publish D and put it on the public, out for the public to have a look at? Yeah. Yeah, thank you. Thank you, Neil. So that is all approved, Amy, the recommendations, which takes us on to agenda item 9, the Forward Work Programme items for discussion. If anybody has
Chair,
anything...
Sorry, that was just on the agenda conference. So you don't have any further items on tonight's agenda. It's just any urgent items under part 1 or 2, which you don't have this evening.
Which I don't have, but I would like, if anybody does have any recommendations, to put forward for our next committee meetings or future committee meetings. I can give you a few ideas, which would be to perhaps stimulate into things that you feel that you might like to see on the works agenda. So if you please like to have a think about what you feel is important that we scrutinise, please get in touch with me and we'll see if we can do it. No urgent items. I'd like to thank you all very much indeed for your attendance this evening, and thank the officers as well. So please enjoy the rest of your evening, and thank you very much for those councillors that took part with questions this evening. So good night, God bless, see you all soon.
Have a good evening. Good night all.
Thank you.